Hi viewers, this is your host Nasrosin Obiambo on Skills versus the Midwife, and today we are going to assess the head. Okay, so let's close in and see what we are able to assess from this. So we will always start by inspecting the head. All right, when we are able to inspect the head, you will inspect for the size, because if the head is too big, then you can suspect conditions like hydrocephalus. So of course, also the size of the head should be proportional to the rest of the body. So that is also something you can pick. And then of course we look at the shape. There are some babies who are born with complications whereby we could be having absent vault of the skull, for example, and those are very serious cases whereby I can give an example of anencephaly. Sometimes we can have swellings like the caput succedaneum, and also we can have cephalohematoma. So these are swellings that could be there, and for the caput it will usually resolve on its own, and that's why it's good to know the difference if it's a caput succedaneum or if it is a cephalohematoma. All right, and sometimes we could also have molding. When we have molding on the head, we normally have sutures. We have the lambdoidal suture, we have the coronal suture in front here, we have the sagittal suture, and we also have the frontal suture. So sometimes if we have overriding of the skull bones along the suture lines, then we realize that the molding might have occurred. So it only depends what kind of molding and the degree. All right, then also palpate the fontanelles. Okay, fontanelles are those junctions in between where the sutures actually meet. So we have a fontanelle here, the bregma or the anterior fontanelle, and we have the posterior fontanelle, which is also called the lambda. So on the fontanelles, you can actually palpate to assess if there's any kind of bulging. All right, bulging could just simply mean there's a lot of pressure, and that could indicate a problem in the newborn. And also along the suture lines, you can palpate to see if they are too wide. Okay, if they are too wide, it simply means that there was no complete ossification of the bones, and that's why the suture lines are too wide apart. Okay, and then of course the head circumference, like we had explained in a previous video when we were doing the vital signs of the baby, we will be able to check the head circumference, and like we said, from the occiput region to the frontal region, and we say the normal is between 33 to 37 centimeters. Okay, so we'll be able to rule out. Okay, we'll be able to rule out. That is the main reason why we are doing the head circumference, to rule out all those complications or anomalies like the hydrocephalus, microcephaly. And then of course for microcephaly, it simply means that the head is too small. Sometimes just maybe to pick something that a conversation that is going on out here, whereby women teach other women, they teach each other that if they see a protrusion on the baby's head, they will teach each other to mold. Okay, there's a conversation about molding. Okay, so mummies, it's not good to mold the head of the head. Like I said, from this assessment, we'll be able to tell if it's a normal caput succedaneum that will resolve on its own, and if it's not, maybe it's a cephalohematoma or any other like hydrocephalus, then this baby will be referred and will be managed appropriately henceforth. So please don't do anything that is not good for your baby. Don't mold the head. That is not correct. That is not good. Otherwise, you can cause injury to the brain structures of the babies. Let's meet in the next video where we'll be discussing on assessment of other areas. Put in your comments and your questions, we'll be able to tackle them.